When it comes to dangerous drugs and medical devices, the majority of the negative side effects are harming female consumers in big numbers. Joining me now to talk about Big Pharma's war on women is Linda Lipson from the American Association for Justice. Linda, more and more literature coming out showing what we've known all along, and that is the pharmaceutical industry, the device industry, women in disproportionate numbers are the victims here. I know your organization has been following this for a long time.
This is an old story. It's a sad story of women's health and the pharmaceutical industry. Basically, what has happened for years and years and years, 60 years, is that women are underrepresented in clinical trials. When they endure a problem with a pharmaceutical product, they go to their doctor and they're told that sometimes they're told it's really nothing. The industry sometimes is not responding to them. Then more and more complaints mount. And the industry, instead of just fixing it and making the product safer, they go into this cone of silence and obfuscation and create an environment where the woman, where the patient is not the first consideration, and they put time and time again they put issues of greed over issues of public safety, and we think it's time for them to change this. But
we see that we do now know that historically they have prevented women from being involved in the initial clinical trials. Now, you know and I know how important the clinical trials are. The clinical trials might be data that they decide this has the potential to cripple a person, to kill a person, but they leave women out. Now, the case I think of that you have when the AAJ did a report on this was a very moving case. And it was the case with Accutane. And so what Accutane was simply a drug that they came up with for people to avoid, to treat acne. It was a drug that was developed for cancer, and they said, gee, I know it's developed for cancer, but let's use it for acne. But they left women out of the clinical trials because they clearly knew, I've seen the documents, and they clearly knew that it would cause birth defects in women. Tell us this story a little bit.
Well, one very sad story of a young woman named Cami, who basically took Accutane for mild acne, not even serious acne, and she took it and suddenly developed ulcerative colitis, and it caused her to endure incredible pain, and Cami died in February of this year. It's just a very tragic and horrible story. And for Cami was taking the generic version of the drug Accutane. And in taking that generic version, because of a Supreme Court decision, Cami cannot hold that manufacturer accountable. The Supreme Court basically said recently that if you consumer have taken a generic drug, you have no remedies. So we feel terribly for Cami, but there are countless other Camis.
Well, the interesting thing about this, Linda, is to me, and you covered this so well in your AAJ report, where you talked about the idea that you had a drug that they knew. Now we know, because I've actually seen the documents, we've introduced them in trial, where they knew that we have to keep women out of the clinicals because we know it's going to cause birth defects, and if somebody's pregnant in the clinicals, then they're going to have birth defects, and we're going to have to report that. But we see this not just with Accutane. Isn't the mesh case another example of this?
Oh, absolutely. It's a different product, obviously, but it is the same story. It's the same old story. With this product for vaginal, which is called vaginal mesh, basically it wasn't even regulated by the FDA as that particular product. They used a similar product, and they basically got in through the back door. This product has been used by thousands and thousands of women. It causes infections and other serious problems. It has to be taken out. And what women are saying about these surgeries that they have to extract it is it's a little bit like getting barbed wire out of concrete. So it's another example of women trying to fix something and creating more problems because the industry is not on their side.
Well, in this situation, as a matter of fact, and you pointed this out, there was no testing. Here they're putting this product in a woman's body. Now, it causes deterioration of the bladder, it causes deterioration of the uterus, all the parts of the body that you can't even get this product out. You described it as barbed wire out of concrete. Surgeons say there's so much damage when it goes in that it's virtually impossible for the best surgeons in this country to pull it out. But here again, women believed that it had been tested. Women thought that the FDA was looking to make sure it was safe. In fact, the FDA did nothing to even oversee the product of mesh. And again, this is one of those issues where they understand that women have more health issues than men. They targeted women, just like they do with birth control. Isn't this another product we see time and time again with a birth control product that causes heart disease, it causes DVTs, it causes strokes of all kinds. Women die. I think in the last 20 years, there have been 5 birth control pills that have caused so many serious injuries that at this point you don't know what a woman doesn't know what to take.
You know, it's not just birth control, it's everything to do with reproduction and the pharmaceutical industry. You know, it started out with DES, moved on to Dalcon Shield, then Copper 7, then we have Ortho Evra, we have Yaz, you name it. It keeps going on and on. It's the same old story. High estrogen birth control pills cause serious problems that have led to strokes, heart attacks, and other problems that have been known for years and years and years, yet this continues.
Well, one thing that I thought was so important about your report, the AAJ, and people miss this. A lot of people don't even know what the AAJ is, and they don't have any idea that it is the only line in the sand where it comes to real consumer protection. But the AAJ report that I read that I thought was so interesting was that in virtually every one of those examples that you gave, virtually every single one of them, in the file cabinets of the home headquarters for every one of these pharmaceutical industries or these device makers, there was discussion. And they say, yes, we know the risk. We know it can kill a person with a stroke. We know the device is so dangerous we're never going to be able to get it out of their body without mutilating them. We know these things, but the profit margin is so big that we'll be able to pay for all these losses and still make a big profit. Virtually every one of the products you just mentioned is a similar analogy, is a similar set of circumstances, isn't it?
Well, yes, and the Supreme Court is making it worse. Let's take the example of a young woman named Chrislyn who took the product Yaz for birth control. Basically, she started to develop blood clots, and she had to get surgery for these blood clots, $50,000 in surgery costs, and she's living with a ticking time bomb because she has this potential for blood clots that could occur any time. So this has just destroyed her personal life, and she has enormous pain connected to this.
Now, full disclosure, I know a lot about the Yaz case because I took the depositions over in Berlin and in Amsterdam. Here's what we found, and of course, what I thought was so remarkable was that you had already identified some of these problems in your AAJ research and investigation before we did. You gave us that information. It was very helpful. But what we found was that they had something they call emotional appeal marketing. And that is this. They were telling people like the young lady you're just talking about that if you take our product, you're not going to have acne. You're going to be able to, your PMS problems are going to be solved. The FDA never gave them the permission to say that the drug should even be used for that. The documents that we uncovered said, A, we know that the FDA has not permitted us to do that. B, we know that it's not true, that we've tested sugar pills and we've compared them to Yaz, and the sugar pill is just as effective as Yaz where it comes to treating PMS. Now, the bad news to all of this is after those documents are uncovered, after it's clear that they know the product is going to kill women, they had a projection on how many women it would kill, they still understand nobody goes to jail. When we took depositions on that case that you just mentioned over in Berlin, the surliness and the arrogance was overwhelming because the people who made the decision understood they would not go to jail. In about 30 seconds, what's the cure here, Linda? What does a woman do to protect herself?
First of all, Congress can go a long way towards fixing this. They can repair what the Supreme Court has done in the medical device area and in the generic drug area by making drug companies that put issues of greed over issues of public safety, make them accountable. If not for the lawsuits that have occurred because of Yaz, because of Ortho-Evra, because of DES, because of Dalcon Shield, because of Copper 7, if not for those lawsuits, we wouldn't know about the dangers that these products sometimes cause. So we need to have a vibrant civil justice system to work in tandem with the FDA and promote the best environment for healthy and safe women.
And Linda, I got to tell you this, what we need is more people like Linda Libson up on the Hill lobbying with the level of effectiveness that the AAJ shows time and time again. I don't know what we would do without the efforts of the AAJ, frankly. And I thank you for joining us. Thank you for this report. Please keep sending us the reports that you come up with because it's vital information the public simply does not know about. Thank you for joining us.